The following portion of Studio 512 is sponsored by BioBehavioral Research of Austin. BioBehavioral Research of Austin conducts clinical trials for adult and pediatric patients. Often that means helping pharmaceutical companies consider the efficacy of approved adult medication for kids. Dr. Lisa Venghaus is here to talk about one of the clinic's current studies looking at pediatric bipolar disorder. Dr. Venghaus, what is pediatric bipolar disorder and how does it present?
When we take a look at bipolar and what it is and how it presents, there's two spectrums because it has severe mood swings. So we have our elevated, high energy, really irritable, which is known as like our manic episode, and then we have what more commonly is known as our depressive state, where we have a loss of interest, feeling persistent sadness. In adults, it's much more distinct in the fact that their mania and their depressive states are more separated and you can see them, whereas in kids, it's a little bit more jumbled up and they're having more mixed symptoms. So they're having mania and depression that's co-occurring, and it's for a shorter duration of time.
Gotcha. So when kids come in to see you and they end up with something like a pediatric bipolar disorder diagnosis, what are some of the symptoms that they're displaying? What might be happening at school or at home that parents and guardians can be looking out for that might be some indicators?
Yeah, so typically when they come into my office and when I see them, we'll be looking at persistent irritability, so they're pretty angry. They might also have distractibility, they're having a hard time focusing, high anxiety, their sleep has changed.
Wow, okay, so we want to do everything we can, of course, to keep our kids safe. Why don't we talk about the current treatment options that are out there for pediatric bipolar?
Yeah, so what we recommend is that if parents are noticing any of these behavior changes, to take their child in to see their pediatrician or their PCP. We also recommend going to see a psychiatrist or getting counseling. We have the ability to go ahead and run our assessments and see if they qualify for one of our studies and potentially be a treatment option.
Wow, it's incredible work that you do, Dr. Venghaus. Thank you so much.
Thank you.
Learn more at bbraustin.com. The preceding portion of Studio 512 was sponsored by BioBehavioral Research of Austin.